So I want to tell my story of how I got really, really passionate about lymph, but more specifically deep lymph, because I had some very obvious lymphedema. So lymph is this clear fluid that moves throughout our body. It's cleaning up all of our fascia in between our tissue. It filters our blood, like it's interconnected in all our capillary beds, and it's got a dead end of where it starts, and it brings all of this fluid back to go back into your circulation to get kicked out through your kidneys and through your stool. And um, it is it is being stagnated in people a lot lately. There are multiple factors that are doing that. And things like the more heavy metals you have in your body, parasites, mold is a huge one that slugs up even your liver. And when your liver feels stagnated, your body actually pumps out more lymph, but it doesn't have the high quality lymph. It doesn't have the amount of proteins it should have in it. And it ends up causing some dysfunction. And so I was getting severe lymphedema on my left side. So your lymph flows, and 75% of it clears through your left lymphatic duct here, which is called your thoracic duct. And then the right side clears half of your head, your right arm, and half of your torso here. So there's only 25% of your body that's clearing here. So when people have lymph problems, they usually feel it here. And what we've been seeing it's creating, and what it even created in myself, is pressure on the cardiovascular system and on the lungs. So the lungs and the heart. And it can create things. Your heart is very electrical, right? It is like an electric circuit. People call it the second brain. It has so much nerve endings. Nerve endings work on minerals, and minerals create energy, and our body can create so much energy that it sparks. We've all felt what it feels like to have a static shock. So now picture this mechanical fluid pushing on your very electrical heart. So these are what we're theorizing is a big cause of all the heart palpitations that people have been suffering, way more than in the past that we've seen it with healthy hockey players, all of these, athletes that are supposed to be top of the line. So people used to think lymph moves just by movement. So if lymph only moves by movement, and these guys are elite athletes, then technically their lymph should be moving quite well. But we're seeing the opposite, and we're seeing a lot of heart effects in them as well. Another big thing is different electromagnetic frequencies coming at us that are stagnating our lymph, because they do have access to our body through our sweat glands. Now that's a whole other topic, but lymph is getting stagnated. And for me, what I could see physical swelling right here. So it was pretty obvious. I had an ache right here. That's something called your apical node. I had an ache right here because when it overflows, the lymph starts to put pressure here. I was waking up with stiff hands, and it was even going down into my back where I would get a stiff SI joint and lats. And we're seeing that a lot in people, and it's causing this even acute back pain. So when you just try to pump your lymph, which you see a lot of people showing you, that's to move your superficial lymph. But what I'm talking about is deep lymph, because some of these players, you don't see the superficial lymph puffing out like it did for me. And you have to use the fascia, because the deep lymph, the vessels are different than the superficial ones. The superficial ones don't have valves, there's not any muscles moving around them, and it's a whole kind of different ballgame. But what we realized is you need to affect the fascia in order to affect the deeper lymph, in order to clear around the organs. So what we see in some people when we're clearing the fascia and the lymph is there's a lot of belching and burping, like this neurological release that makes space. We see instant colors coming to their face, or changes in their whole behavior, and that whole stress. People are having something called jump out of your skin anxiety, or things that are getting improperly diagnosed as panic attacks. I've tried to explain this in the past in a series that we did on Instagram that we should bring to the top, because it's is it anxiety or is it toxicity? And what does lymph carry with it but a whole bunch of toxins that is trying to get out? So now imagine your lymph all clears under your collarbones. Your vagus nerve is most superficial here. So we get an overflow of lymph with all of its waste and toxins. It can affect the thyroid, it can affect the vagus nerve, and it's gonna make you feel stressed. Your body is gonna try to give you a sign to try to tell you, you've gotta do something, you've gotta sort it out. And what we're seeing is anti-anxiety meds people are having this breakthrough anxiety through that, because we've got to get the lymph moving. We've got to lower the overall toxic load. So our goal is to share our story and our techniques from being manual therapists for the last 15 years and then going through this myself, and how I helped to start to clear my deep lymph to start to heal from severe Lyme disease and probably a mix of long COVID with the EMF exposures. And this is going to be probably for a lot of people maybe an aha moment where there's that trigger point where everything kind of turns in your body. And we talk about the toxin overload and the toxin bucket. Well, if you can get your deep lymph moving, you can start to clear these toxins and your immune system is going to function better. You're going to feel less stressed. You're going to look better. You're going to have the anti-aging effect, and you're going to start to understand the power of the deep lymph. So that's what we're introducing to you. We have a course. It's going to be amazing. It's a self-help course, and then we're going to do a course for practitioners because more people need to know how to do this because it's becoming an epidemic that no one's talking about. So keep your eye out. We're going to start to do webinars, and we're going to start to announce to you the course and when it's available.